Thank you for joining the Central South Carpenters Regional Council Teletown Hall. I am Jason Engels, Executive Secretary-Treasurer for the Council. We'll begin momentarily. We want to give our members an opportunity to join. At any time during this forum, if you have questions for our speakers, simply press *3 on your telephone keypad. We will take questions live later in the hour. In just a few minutes, you'll get to hear from 4 guest speakers: UBC Southern District Vice President Dennis Donohou, U.S. Congressman Lloyd Doggett, Council Attorney Jay Youngdahl, and Council Political Director Gary Warren. While we wait for additional members to join, I want to encourage you to join the Central South texting program, which we use to send important information to our members. To get our text alerts, just text CSCRC to 24587. Or if you're listening on your cell phone, simply press 1 now and we'll add your phone number after this call. To get your council representative's phone number texted to you, text LU and your local union number to 24587. So if you're calling from local 551, you would text LU 551 to 24587, and you will get local 551's council rep contact info in return. So during this time of uncertainty, we know you have a lot of questions and concerns. Our council reps are available around the clock to help you. So again, text the letters LU and your local number to 24587, and you'll receive your council representative's phone number in response. Okay, so let's begin our meeting. Remember to press *3 if you have a question. We called this meeting to address how the coronavirus is impacting our membership and their families. And there are a lot of resources available for you. And at this time on the phone, we'll show you the different ways to access help. First, we've set up a coronavirus information center on our website, centralsouthcarpenters.org, and on our mobile app. The center contains information to help you navigate through this crisis, such as how to file for unemployment benefits in your state, status of both our local and the UBC's International Training Center, how to contact your local health funds, contact for state and federal health organizations, and even what to do if you're feeling overly stressed. Second, we've activated the Central South Carpenters Relief Fund. Right now, we are offering a $50 gift card to members in good standing, with additional funds possibly being available in the future. Check the info center for directions on how to apply. We are honored to have UBC Southern District Vice President Dennis Donohou join us tonight. Under Dennis's leadership, the Southern District has experienced unprecedented growth in membership and man hours for several consecutive years. Dennis, thank you for joining us, and you are now live.
Thank you, EST Engels. Good evening, Central South members. You know, this is unprecedented times we're living in. As a country and as a union, we have never faced a situation like this. But I want you to know that we will survive this together and we'll come out of this stronger. I want you to also know that the UBC at the international level, the district level, and the council level are in this battle with you. In the Southern District, we are coordinating daily with all the 4 regional councils and helping to not only disseminate but also to interpret all the information that is out there. And we know that information is overwhelming for most people. So we're trying to coordinate that and get the information to you in language that you can that we can all understand. Not only information concerning the COVID-19, but information on the Family Leave Act and the CARES Act. And the CARES Act, that's the stimulus bill. We are meeting every day with the attorneys to ensure we are, number one, interpreting the laws correctly, and number two, to ensure you, the member, that all the resources and knowledge you all have to access the help that is available to your family. Information concerning the virus and the stimulus package is welcomed, of course, but the language is sometimes confusing. What and who does the stimulus bill cover, and how do you access the help that is available? These issues are what we are focusing on to make it easier for you. We are also concerned about the safety aspect of your job sites. We're making sure that projects are following the guidelines of safety protocol. And lastly, we are working to make sure that as many jobs as possible are still there for our members. We want you to have work opportunities, but we also want those to be safe opportunities. And I will close by saying that we belong to a union that cares deeply about you and your family. And we are working tirelessly to make sure that the UBC families come out of this pandemic as healthy and as financially sound as possible. I want to thank EST Engels and his entire staff who, in my opinion, are doing a tremendous job of getting information out to you guys and protecting your families. I'll turn this back to Jason, but from myself, from our union, and from my family to yours, I wish each of you good health. Good night.
Thank you, Vice President Donohue. We certainly appreciate your support and hard work for our members, in this uncertain time and always. And thanks again for joining us tonight. Thank you, Dennis. Our next guest is another strong advocate of human rights, U.S. Congressman Lloyd Doggett of Austin, Texas. As a member of the U.S. House of Representatives, the Congressman is a strong defender of Social Security, Medicaid, health care, immigration reform, the environment, our veterans, and public education. Coronavirus has been Congressman Doggett's top priority since January. He is also chairman of the Ways and Means Health Subcommittee. Congressman, the floor is yours.
Well, thank you so much, and I want to say a special thanks to all of the union members that are out there literally building our country during this very tough time when it seems that so much is falling apart. I will tell you that I share the kind of concerns for my family members and loved ones and close friends that I know each of the people that's listening in this evening share about theirs, trying to get the facts, trying to decide what to do and how to go forward. This crisis is something that could have been prevented in a large measure or at least significantly reduced. I don't believe that there's any country that is really immune to the virus, but when all you do is deny and delay and claim there's a Democratic hoax and not a real problem, you don't get adequate protection, you don't honor the warnings, and in the process, many lives are in danger. I'm not going to sugarcoat anything here. We've got some hard times ahead of us. We have no choice but to endure many more days in which most people are homebound, business and schools are closed. I think that, shuttering businesses and having layoffs and keeping people at home is a sorry substitute for comprehensive testing that should have occurred. If that had happened, we wouldn't need to be doing all this. But in fact, we don't have the testing still tonight to test those who want to be tested and need to be tested. And we really don't have enough information about how this virus is being transmitted from neighbor to neighbor. And that's why we've moved in many areas to these rather extreme measures of telling people to stay home, can't go to a restaurant, can't go to church, kids at home, creating all kinds of challenges. Now, I know that in the case of our union carpenters, many of you are still on construction jobs. I represent an area here from North Austin, the south side of San Antonio, and I see construction sites in operation very near where I live. Yesterday, I got a call from a nurse who had just quit her job for a health company that had been hired by one contractor. And the reason she quit was that they weren't providing her any protective gear, and they were insisting that she check the temperature of every worker on the site. But instead of giving the normal kind of thermometer to do that, they were using some device that is used to check hot and cold spots in a building that happens to be plus or minus 5 degrees, which doesn't do you a heck of a lot of good in checking to see whether somebody's running a fever and might have the virus. So what I would say about the work site is insist on safe practices, on having the right gear as you would on any work site, and question what steps are being taken to keep you protected from this. The challenge, because we haven't had adequate testing, is that we don't really know who's transmitting it. Could be a child, could be a person that shows absolutely no sign of having anything wrong with them and doesn't realize that they are carrying coronavirus. And so the social distancing that's being mentioned applies at the work site also. Avoiding as much contact as possible where you are right next to somebody, where you don't maintain 6 feet or more distance, is challenging on many construction jobs that require 2 or more people to get the job done right. But minimizing that contact is essential for your life. Now, what we've been doing in Congress is trying to find a way to assure that we get more testing, first of all, to assure that anyone can get a free test. And we have provided for that in law. But in fact, there are not enough tests out there to test everyone. And I think it'll be the middle of the summer before really everyone who wants a test would be able to get one. So we have to engage in these other practical aspects. What we've been trying to do is provide enough support for all these people that are being laid off through no fault of their own, like restaurants and bars and businesses being shut down and the workers told to go home, to provide them some protection. For those that stay on the job, to provide for paid sick leave, and for those that are off the job to try to have enough emergency unemployment assistance that they can make their bills. Here we are at the first of the month, truck payments, all kinds of payments, credit cards and the like coming due, and people in many cases without the wherewithal to be able to cover their bills. So we've provided some emergency unemployment assistance in addition to the traditional unemployment assistance. At the same time, there was a report this week in Austin that the best time to reach in fact, about the only time to get through to the Texas Workforce Commission to apply was between 1 and 6 a.m. in the morning, because they've, instead of having a few thousand, have had hundreds of thousands of people apply for unemployment assistance. So that's a backup. It's certainly not a substitute for a good union-paying job, but it may be something that one of your family members or even you eventually need to face. In addition, we provided for some direct cash payments, and we've been arguing with the Trump administration about getting them out more quickly. Basically, if you make less than $75,000 a year as an individual or $150,000 filing with your spouse, you're entitled to get a check for really direct deposit for $1,200 for an individual and $500 for each child. They're going to base that on the fact that you filed a tax return either this year or last year, or if you or a family member are receiving Social Security benefits. This will be a payment that's made automatically. If you did direct deposit, maybe you filed for a tax refund already. If you do direct deposit, that will be deposited into your account, and we are pressing them to get it there promptly, and this applies whether you're working or you're not working on a job. For the newly unemployed, as I mentioned, there's an additional benefit of $600 a week that has been added in for a temporary period of time to try to help. We are already working on another bill. One of the main aspects of that is to push the infrastructure bill we've been unable to get agreement with the Trump administration on for the last several years, so that we can begin building more roadways, floodways, bridges, and the like, which our country, as you all know, desperately needs. While Senate Majority Leader Mitch McConnell has been pouring a lot of cold water on it, President Trump has indicated some support, and I hope that we can get together on this as a way to move our economy forward. Regardless of how long it takes us to get I think we have to keep working with our health professionals and listen to what they say is the safest way forward, the doctor's advice, not some politician who doctors the truth. And while our president never seems to accept responsibility for anything, and I think would prefer for us to just have an epidemic of amnesia about all the things that has not been done with his administration that have gotten us into this situation, I think we need to learn from what's happened, to listen carefully. How we voted in the last election This is a virus that doesn't discriminate between Democrats or Republicans or anything else. We're all in this together, and we need to learn from the failures that have happened, not listen to the exaggerations and misrepresentations, and each of us do our part in doing appropriate social distancing. I'll just put it plain to Central Texas, either stay 6 feet apart or we're going to have a lot more Americans that will be 6 feet under. Know that we'll be working together with you and listening to your union leadership and to you because you're really important to us. We value for what you do to America, understand the challenges that your families are facing, and want to be there to listen and back you up as much as possible. Thanks a lot.
Hey, thank you, Congressman. Your insight is always right on target, and we really appreciate your time this evening. Okay, so let's take a quick poll. We'd like to know how COVID-19 is affecting your work. So on your phone, press 1 if COVID-19 caused you to be furloughed or laid off, press 2 if your hours have been reduced, or press 3 if you haven't experienced any change in your work status because of the virus. Again, press 1 if you've been furloughed or laid off, 2 if your hours have been reduced, or 3 if there's been no change in your status. And I'll read the results momentarily, but while we wait, I'll just remind you, if you have a question, please press *3 to get in the queue. All right, while we're waiting on the, here, I think we have most of the results in, so I'll go ahead and report on them. We have on the call, out of close to 2,000 participants, roughly 27% have been laid off, 15% have had a reduction in hours, and 58% their situation has not changed. So thank you. Our next speaker is Jay Youngdahl. Jay Youngdahl has been our attorney since the founding of the CSCRC. He is the attorney for the Southern District of the UBC, and he and his father have been representing the UBC since 1958. Jay is an Arkansas native and was a local union organizer and officer before he got his law license in 1980. He is leading our legal effort during the virus crisis in the South. Jay, you are now live.
Thank you, Jason. Thank you, Congressman, Vice President, and I'm just going to take a few minutes here, brothers and sisters, to talk to you about where we are legally. First, I want you to know that we are looking every minute, every hour at all of the legal issues that affect you, our membership, and your families. And we understand through Jason's leadership and through the reps, the issues you're facing, and we're focusing on those issues, the issues of our membership. To be frank, part of the problem is that the federal government has not yet put out the rules and regulations to consider some of the more complicated questions. For example, the congressman talked to you about potentially getting money under the Emergency Paid Sick Leave Act. The Department of Labor announced yesterday they were going to wait until after April the 10th to do the final regulations on how this is going to apply. So for a lot of the questions you say, well, I can't figure out why this is happening, the reason is the federal government hadn't put out the information. But I'm going to give you, and we stay up on the best information we can. I review the governmental websites on at least an hourly basis to make sure that I have the latest information. And I coordinate my work with Vice President Donohou so that the entire UBC over the United States, as soon as one part of us knows something, all of us do. And also in my 3 or 4 minutes here, there are several questions that came in advance, and I'm going to answer some of those as well. So legally, 2 major bills have been passed. The Families First Coronavirus Response Act, FFCRA, and then the Coronavirus Relief and Economic Securities Act, or the CARES Act. Both of them are designed to give economic relief for businesses and workers who've been affected by COVID-19. The first thing they've done is increased benefits coming from unemployment insurance. And I'm not going to cover that much. Gary Warren is going to do that right after me. But the access is expanded. The amount of money one can get have gone up. The length of time you can get unemployment has gone up. And waiting periods have been eliminated. Federal government will give money on top of what comes from the states. At this point, we're fortunate that 58% of our folks have not had any job change, but who knows what the future is going to be. It's also the case that a number of people who were not subject to unemployment before, people have already exhausted their benefits, independent contractors, et cetera, are going to be able to qualify, but Gary's going to talk a little bit state by state. The second is paid leave, paid sick leave. And here we have employers under 500 employees, that's some of our contractors, but not all, who are required to pay 80 hours of full-time pay and pay your health insurance hourly bank premiums into our health plans if you're subject to a certain number of conditions. If you've got the disease or you've been told to isolate or to quarantine, either by the government, by the healthcare provider, you're covered under this. Or if you have those symptoms and you're seeking diagnosis, you're covered for full pay up to $511 a day for 2 weeks or for 80 hours. You can receive 2/3 of your regular pay, although capped at only $200 a day, if you're caring for someone who is subject to quarantine or isolation, or caring for a son or daughter if the school or child care facility is closed that you would normally use. And again, part of the pay includes paying the health insurance premiums, or in our case, our bank. It does not include generally other benefits like paying into pension, paying into our training fund, these kinds of things. And as you know, in general, training has been put on hold at this point. Also, for people who have a lot of family issues of this type, the Family and Medical Leave Act has been strengthened, so that may be a possibility for you. There's also direct payments that are going to come. Y'all, ladies and gentlemen, can read when they're going to come. We're not quite sure yet, but as the congressman said, this is going to go probably by direct deposit for people who have that direct deposit information in the Social Security system or in your tax system. That's something to watch for. We still have a number of regulations that need to come out about that. We're waiting on those. There's also a tax credit that employers are going to get for keeping people on the job. Now, we're watching this very closely because we had one question about, well, what if employers trying to take money and not pass it on to us, to the workers? We're on top of that. We're watching that. But the rules and regulations have yet to come out from the federal government. So everybody, frankly, is a little bit confused on that. There's also a program called the Paycheck Protection Program. And one or more of these may even apply to our training programs to allow us to keep our good instructors around. So when things get going back up, we can get that good kind of training. We are watching that. And we're also watching to see if any of these apply to our union, because obviously every part of us is going to be stressed, our families, ourselves, our unions, our jobs, all of that. So we're watching on that. We understand very much that health care is a major concern for all of us. I can tell you right now that, and I'm the lawyer for most of the health or the funds that cover most of the folks here in the CSCRC. Our funds are very well funded. And at this point, any testing is being paid for 100%. I believe that any treatment that's needed because of the COVID is likely to be covered by 100%, but that's still being worked out. We're still having discussions with Blue Cross Blue Shield, but we have more than enough money to take care of that. We may have an issue coming in the future if people's hour banks get shrink down. I guarantee you that the trustees have already started talking about that. But one of the concerns here is that we don't know how long this whole thing's going to last. And so we have to make sure and take care of the most serious problems first, always looking towards the future, but making sure that if, for example, medical conditions get worse and worse, that we've got money to treat everybody. That's being done. We also understand issues of People who have money in pensions or in annuities, the trustees are already discussing those funds. We now have an annuity fund that covers all of our states. Dennis Donohou, our vice president, is the chairman of that. He's been doing this for a long time, so we're looking closely at that. But at this point, we don't have a crisis and people needing to take money out. There is some money, like Jason said, from the relief fund, but we're looking at that. And if we get to the crisis, I guarantee the trustees will look at that. We'll look at that very closely. A couple other things I just wanted to add: problems with your mortgages. There is in these laws mortgage forbearance. That means that you may not have to pay it, or at least you may get an extension. Again, the regulations haven't come out for that, but we're going to take a look at that. And then finally, on this, in some states, we have a lot of folks who are working, and we've had some people who've been stopped by the police who've been told that they weren't sheltering in place. If you think that's a concern of yours, we've provided draft language to put into letters to the reps or to use by employers. So you could carry one of those letters if you needed to go back and forth to the job site if you live in a state that has that shelter in place. And then finally, I'll say that there are priorities, like the congressman said, in future next law. They include trying to get subsidies for COBRA if we go to there, trying to get subsidies for the health and welfare funds. We know our pensions are going to take a hit in terms of the investments and subsidy there because the banks have been bailed out. Why shouldn't our pension funds be bailed out if we get to that? That's something that your UBC folks up in Washington, D.C. are fighting for right there. So, Jason, I'll stop it right there, and I can help answer questions at the end or however people like.
Thank you, Jay. Great information as always. So our final speaker is Gary Warren, a brother of Local 1098 who is also the council political director. Gary is going to help us get our arms around the unemployment rules and filing information. Gary, the floor is yours.
Thank you, Jay. Good evening, everyone. As a result of the
Gary, are you with us?
unessential by state and federal governments to reduce operating hours or close their doors, are laying off, furloughing, reducing working hours, and cutting the pay of the workforce. If your employment has been impacted for reasons related to COVID-19, you may be eligible for unemployment insurance. Unemployment insurance programs are different in every state. Benefits are calculated differently, but in general, they collect unemployment insurance contributions from employers, provide unemployment insurance benefits to those eligible, and maintain management information systems for filing unemployment insurance claims. In most states, there are multiple ways to file a UI claim. Also, your state will require you to provide them with information in order to file your claim.
Hey, Gary, can I interrupt you? Could you take the phone off speaker, please?
Lack of work due to the coronavirus, or your workplace closes temporarily, and you are not being compensated, or you have been instructed not to go to work, and you are not being paid while at home. Currently, in most states, you can draw unemployment insurance for 26 weeks, and an extension of benefits has been added for an additional 13 weeks of
Hey, Gary, pardon the interruption. Could you take your phone off?
That be immediately made available. The federal government is providing incentives for states to eliminate waiting weeks to get money in people's pockets sooner. The first week of your claim also known as the waiting week, will be waived if your state is participating with the federal government programs. You may receive your unemployment insurance benefits by check, a debit card, or through direct deposit. In most states, eligibility and verification requirements that you must continue to meet are also being waived.
To be eligible for benefits based on your job separation, you must either be unemployed or working reduced hours through no fault of your own. Examples include layoff, reduction in hours, or wages not related to misconduct, being fired for reasons other than misconduct, or quitting with good cause related to work. Quitting for good cause related to work, which means a work-related reason that would make an individual who wants to remain employed leave employment. You should be able to present evidence that you tried to correct work-related problems before you quit. Almost all states are experiencing extremely high call volumes and long wait times for individuals that are filing UI benefits. Many online users are also experiencing problems with trying to file online. Solutions: try off-peak hours to contact them. Online, try late at night, very early in the morning, or even in the middle of the night when site traffic would be less. Or if you're calling, then call right when they open at 7 or 8 a.m., depending upon your state. Also, members who need assistance, please contact your state representative or state senator as a constituent and ask for assistance in reaching your Workforce Commission, Labor Department, Unemployment Insurance Office, or Employment Security Division. In Louisiana, you can file a claim online or by calling a claim center. The maximum UI benefit in Louisiana is $247 a week. If you add that to the $600 that Mr. Youngdahl mentioned, then that would, as an example, be $847 per week. This is done to help make employees whole. In Texas, you may also apply online through the Texas Workforce Commission, or you can call their telecenter at 800-939-6631. I would advise you to use the tutorial in Texas before filing. Business hours are from 8 to 6 in Texas. They are experiencing very, very long wait times and a lot of volume. They have this problem. In Arkansas, through the Arkansas Division of Workforce Services, you may apply in person, online, or by phone. The maximum UI benefit in Arkansas is $451. I skipped Texas. The maximum UI benefit in Texas is $521 per week. In Oklahoma, you may call or speak with a representative filing a claim by phone. However, the Oklahoma Employment Security Commission is experiencing high call volumes, so they ask that you file a claim online and access self-service features by clicking Claimant Access. The maximum UI benefit in Oklahoma is $520 per week. In Mississippi, if you worked and earned wages in Mississippi, you may file a claim for unemployment insurance benefits online or by calling 601-855-3133. The maximum UI benefit in Mississippi is $235 per week. That concludes my report for unemployment insurance benefits. I hope you all stay safe. Good luck.
Hey, great information, Gary. Thank you. So let's take some questions from our members. So brothers and sisters, if you have a question, again, please press *3 at any time. So our first caller will be Jody Bienvenu from Local 1098. So Jody, you're live.
Yeah, my question was,
Jody, I think we lost you. Maybe try to call back in. How about the next caller? We have Peter Sabatucci, Local 71. Peter.
Now, the last fellow that was on there, he answered my question. It was about what our retirement is going to, if it's going to be effective or not.
Okay. Well, thank you very much, Peter. So your question was answered.
Okay.
So
Tell Dennis.
let's go to Russell Green.
Good evening, gentlemen. Good evening. My name, I'm Russell Green from Local 429 in Fort Worth, Texas, Arlington, Texas. My question is regarding the stimulus. Okay, like last year when I filed my taxes, I owe the IRS. So how does that affect, how would I get the stimulus check?
Jay, would you like to answer Russell's question, please?
Sure. Russell, good, excellent question. The only thing that gets deducted from your stimulus check would be child support. Even if you owe the IRS money from past years, that does not get taken out. The only thing that gets taken out is would be child support, and the money that you get is non-taxable. That is, you don't have to report it next year.
Great. Thank you for that great question. Next, let's go to Leon from Local 1846. Go ahead with your question. Leon?
Oh, yes. He answered it with the unemployment. I was up there talking about like when they say if you didn't work that certain quarter, whatever. He said that's being waived. So he answered my question pretty much.
Well, great, Leon. Hey, thank you for being on the line. We appreciate it.
All right.
So let's go to Tommy Spivey. Tommy, you're live with your question, please.
Yes, this is Tommy Spivey from Local 1836 out of Russellville, Arkansas. My question is there any way the members of the district council can find out either by a website or some other means if there's any way the brothers and sisters need some financial help due to the untimely deaths of the coronavirus, to set up some kind of fund that can be set up for them so we can donate into to help them out for us members that are still working?
Hey, great question, Tommy. So, what I would recommend is the Central South Carpenters and Millwrights Relief Fund. Any member that might be affected due to this COVID-19 virus, we're certainly requesting that information to come to the council, whether that's help with medical bills or, somebody being out of work. And members can make donations to that fund. If you visit our website at centralsouthcarpenters.org, you can navigate to the relief fund, and we're happy to help as well. If you texted that number to receive your council rep's information, they can certainly guide you as well. So, Tommy, thank you very much for your question. So next, let's go to Johnny Forehand. Johnny, you're live.
Thank you. My name is thank you. My name is Johnny Forehand, Local 665 out of Amarillo, Texas. I have 3 questions. Real fast. What documentation do I need if I live with a high-risk family member? My next one is, does pay start from day one that I stay home or the day they approve me for the emergency relief deal? And my third question is, can I qualify for child care if my wife is working from home because she works for the school district?
Hey, great questions, Johnny. Jay, would you mind answering Johnny's questions?
Sure. So, Johnny, we talked a little bit about your situation with your rep. At this point, I think the person involved is a mother-in-law, and we're waiting on trying to find out from the government how that might work. I do think that it does say in there that if a medical professional says you need to quarantine, then that generally makes you eligible for the paid leave. What is confusing about it is, does it say that you need to quarantine or you need to do that to not hurt somebody else? And that's what we're trying to get some guidance on. And then on the pay, unfortunately, this is the thing where I said that the regulations for that are not even going to come out to April the 10th. So I suspect it'll come from day one, but I can't tell you that for sure because we don't know for sure. And then on the issue of childcare, I think it's the same thing. I think you would probably be entitled to that if the schools have been shut down, but exactly when that would start is unclear, and we won't know until next week. So I wish I could tell you more. I guarantee you that your questions being written down, and as soon as I see any exact information from the government, we'll let you know. We're also willing to talk to any employer that has questions about this and in which we can advocate and help, even if I got to talk to the company lawyer or whatever I've got to do to try to get everybody protected. I'm able and available to do that, immediately. So just get with your rep and we can work on that. Thanks for the questions. Great questions.
Great questions, Johnny. So I've got an email question from a member of Local 724, and it says, as you know, many of us are concerned about our job security and our safety at work. Some of our members are nurses in Alamogordo, New Mexico, and on the local level, we are contributing for materials and supplies so that the nurses can have their own mask made. What can the council do right now to help support these nurses acquire critically needed PPE to ensure their safety on the job? I think that's a great question, and with the number of callers on this line currently, I think if by everybody hearing this, you contact your council representatives, any extra PPE, whether it's mask or anything else, we can certainly donate that and send it to our training center in Pasadena. It's 5500 Spencer Highway in Pasadena if it's new PPE, and we'll get that to the nurses that are represented by the council. So great question. So let's go to George Couture Jr. You're live with your questions, please. George?
Yes. I
Go ahead.
was wondering, my work situation really hasn't changed. I work for a construction company out of local 1846. Right now we offer work because we're not being supplied with the piles that we need for the job that we're doing. Why doesn't the council or the district council, whoever handles this, release some of, I call it a supplemental retirement, that we can't touch it till 55, to some of the members?
Hey George, terrific question. So, George, we, as Jay mentioned, we have the Central South Carpenters and Millwright Defined Contribution Fund, and the trustees, both labor and management. The research is being done currently on the best way to release those funds and have members make applications should they need them. So that'll all be communicated here in the very near future. But like I said, that's currently being looked at as part of some of the acts that have recently been passed on the national level. So we'll make sure we've got your information to follow up with you very soon. So next, I want to get to as many questions as possible before our time ends today. So let me go live to Darren Washington. Go ahead with your question, please. Darren? How about Matthew Green, Local 1266? Matthew?
Hello.
Hey, Matthew, go ahead with your question.
Yeah, can you hear me now?
I can.
Okay, so my main question was, I'm one of the fortunate ones to actually have unemployment in Texas, but the bad news is funds are about to run out. And so when you go on the website to actually check that, it doesn't reflect the additional 600 or the extended benefits. So I'm kind of wondering when that's going to reflect on the website. And then my second question was, I currently owe child support, but I've been making payments regularly, and I've read and heard that you will not be getting a stimulus check if you owe any child support. So like for people that have been paying regularly, but they still have arrearage, even though I've been paying for, a long time without a missed payment, I still have arrearage, so I'm still not getting a check. So I'm just kind of wondering if that's true, and I guess that's the extent of my two questions.
All right, Matthew, thank you. Gary, would you mind handling Matthew's question, please?
Sure. Hi, Matthew. I can answer the first part of your question. So I understood that your benefits were running out. The federal government is adding 13 weeks in their stimulus package to the unemployment insurance benefits, and they potentially could add more than that through the end of the year. But that's what's in this first stimulus package. I believe that it may not reflect it for it may be 3 weeks before it reflects that, and part of that has to do with the state signing a partnership with the federal government, and so it should give you that extension. I cannot answer the question regarding the child support. I don't know the answer to that.
So I can jump in. This is Jay. It's my understanding that it's only child support that has a lien against your tax refund. So for people who are paying, they pay child support, but it's the normal child support. It has not been a lien has not been placed against your federal tax return, then you're in fine shape. But if a lien has been placed, then it would affect it.
Great. Thank you. So next, I'd like to go to Ricardo Pagan. Ricardo?
I wanted to say thank you to all of our leadership and everybody that's made themselves available during this time. I know we're grateful for all you all and your efforts and everything that you're doing. My question is in regard to medical benefits. My wife is currently pregnant at the moment, and she also suffers from an immune deficiency. She doesn't have an immune system. And I know that our benefits are based on our work hours and our bank and all of that. Speaking personally, I'm more on like the trade shows and things of that nature, and I know that that's all been affected because of the virus. So my concerns are, Lord forbid we run out of a bankroll or our coverage is up. How do I then go about taking care of my wife who has both her pregnancy and the lack of immune system, being high risk for the virus?
Yeah, hey, great question, Ricardo. So, first of all, I'm sorry to hear about your situation, and we wish you and your wife and your family the best. As far as the health fund, I would recommend, visiting our website to contact a health fund administrator to get, your exact situation. But I can tell you that we are, as we are on the defined contribution annuity, and Jay had mentioned our health funds are strong. We are looking at every possibility for the health funds to, because we know that's the next wave of really concern if people are laid off and their hour banks are running out. What we can do to provide some type of assistance and also keep our health fund strong. So after this passes, we'll still have a great fund. So, we're looking at that, whether that means like self-paying hours or, doing something with COBRA. since, if you're drawing unemployment and taking in a little more income due to the $600 as part of that Stimulus CARES Act, we'll try to make it where it's cost effective if our members' insurance starts running out. So, but right now I would recommend contacting, the administrator of the health fund if you visit our website for your particular state, which I think is Texas, and we can certainly provide you, some detailed answers to your questions. So thank you for your question. Let me go back to, how about Darren Washington? Darren, are you on?
Yes, hello?
Yeah, go ahead with your question, Darren.
Yeah, right now I'm currently working, and I was worrying about the PPE. Okay, we take chances with our life every day when we go to work. We're in the construction field, and I'm forced to work relatively very close to the next guy or several other guys. And with the social distancing, that's kind of hard to do. But when I go to work, I'm fine. And when I come home, I want to be that same way because I have to come home to my family. I trust the next guy the same way as well. But then, somebody might come in feeling fine that morning, but then in the course of a day, develop some symptoms or something. And then he just can, just affected everyone there. It's kind of hard to practice social distancing. I heard what y'all said, but I was just concerned, it's nothing in place for that other than, being self-aware.
Sure. Well, Darren, you're absolutely right. I think one thing we've done recently, a lot of various contractor associations have developed safety protocols for construction projects for around the country, and we've actually put a lot of that information on our website. And you're right, on the construction sites, it's really hard to practice that, and you heard the congressman talk about that. So we want to make sure that the owners of these projects understand that project deadlines and things may not be met as, obviously as quickly because, people are going to have to take time to wipe tools down, to thoroughly wash their hands, provide running water on the job sites and so forth. So that is something that, part of this call, part of the information in our resource center is to educate our members so that everybody takes a personal responsibility in keeping, not only your brothers and sisters safe, but so you don't bring that home to your individual families. So at the same time, and where you can make a living. So with that,
and Jason,
go ahead, Jay.
Jason, I can say too that remember that our collective bargaining agreements still apply. And, yes, it's the time of coronavirus, but the union contract still applies, and we have safety and health language in there, and OSHA is still functioning. So if you believe there's an unsafe condition on your workplace, talk to your steward, talk to your rep. We still have some things that we can do because sometimes the contractors don't realize, what's totally going on like y'all do. So those tools are available.
Great. Hey, great question. So look, we'll take one more caller, and then we'll finish up the call. So let's go live to Leona. Leona, go ahead with your question, please.
Yes, I was wondering with the shelter in place that's going across from state to state, and we have factory workers and contractors who are laid off, and in the news so far we're seeing that this could well happen until June. Are we still able to stay financially afloat as this is forecasted to continue further out?
Hey, great question, Leona. And yeah, we have an organization, the UBC as a whole, and our Central South Regional Council, we kind of plan for these unfortunate circumstances, not necessarily this pandemic, but, we can operate just like any other business, obviously on a reduced budget when man hours are lacking a little bit. But we are a strong organization, and we can withstand this pandemic. And now operational procedures may change in some cases, but I can tell you one thing that won't change is the representation and the service that we provide to you and every one of our other members across our states and across this country. So that will not change. And so I hope that answers your questions. And, you know, we'll take one more. How about Daniel from Local 1846? Daniel, are you there?
Hello?
Hi, Daniel. Go ahead with your question.
Yes, I was working at the cracker plant in Pennsylvania along with a lot of my other brothers and sisters, and I was just trying to find out because I filed for unemployment out there and I really haven't received anything yet. I was just trying to find out if you should apply for Pennsylvania and Louisiana.
Well, you know, Daniel, I'm not sure exactly how long you worked up there. I would certainly probably check in with their unemployment office and obviously look at, you know, if you meet the requirements to file in Pennsylvania, if they have a higher unemployment rate. I know, you know, in the past, if you worked in 2 different states, you could file for unemployment in any state. I don't know if that's still the case, but I would certainly just ask that you investigate that, and you know, we can certainly have our council rep follow up with you with that information to make sure you make the best decision. Okay? So, hey, okay. Yeah, great, thank you. So, look, great questions, everyone. Let's take one more poll. We'd like to know how you prefer to receive, you know, council news. So I would ask if you press 1 for email, press 2 for text, and press 3 for social media. Again, press 1 for email, 2 for text, or 3 for social media. I'll give you a minute to respond. Okay, great. It looks like, you know, the majority, email was about 22%, text is 78%, and we had 0 responses, or 4% on social media that just came through. So I appreciate that. That'll be helpful. It looks like the majority of you would like to receive information through text. So, well, you know, our time is coming to a close, and I first want to thank our speakers. We appreciate all of your insight during this uncertain time. And know that our staff is working around the clock to get you the information you need to keep your family safe and preserve your work status as much as possible. Things are changing, you know, sometimes by the hour, and we'll do everything we can to make sure you're in the loop. The best way to get the most current information from us, again, is to join our text messaging program. Again, to get our text alerts, text CSCRC to 24587. And if you're on your mobile phone right now, you can press 1, and we'll add your phone number after this call. And also remember, to get your council representative's phone number or several phone numbers, text LU and your local number to 24587. So again, if you're from local 551, you would text LU 551 to 24587, and you'll get your council representatives for that area. I would also urge all of you to download our mobile app. To do that, go to your phone's app store and search for CS Carpenters. Our council's logo should come up as the icon for the app. Simply download the app, open it, and get instantly plugged into the latest news about the council. And in closing, let me summarize by saying this. You're not alone in this, and we're here for you, and we're going to make sure that every brother and sister has the resources they need to get through this crisis. So take advantage of the relief fund if you're eligible, and visit the council's Coronavirus Information Center, whether that's through the website, the app, or your website for your local union or our texting program. So look, the last thing, we weren't able to get to every question tonight because of time, but if you have more questions after this call ends, when you hear the prompt, leave a voicemail message and a council rep will follow up with you regarding your question. I hope that all of you are staying safe. And please follow the experts' advice of hand washing, the surface sanitizing, and social distancing as much as possible. And please take care of yourselves and your family. Thank you again, and have a great night.